headache is a huge field. So it's not only migraine. There's too many types of headaches. There's the migraine headache is one. There's the cluster headache, which has multiple type of headaches under that umbrella. And there's the tension type headache, which is another field. So differentiating between those three headaches is a little bit difficult sometimes. We have to do by time, we have to do by symptoms, we have to do by signs. The most common is the migraine. With the migraine, usually patient comes in with headache. Let's say just headache. The headache has been going on for years. They describe it as a throbbing-like headache that they cannot function while they have it. Usually they have some associated symptoms with it, like noise or light sensitivity, and sometimes nausea. So that triggers us that tells us that this is most likely is a migraine. Sometimes it comes with other symptoms such as dizziness or vertigo. Some people say blurry vision or seeing some zigzags, or having an aura. Some people will have definitely some weakness on one side of their body, or even numbness or tingling there. And persistent headache, duration-wise, for sure it has to be not less than 3 hours. And not more than 3 days. Now, saying that, it can be said that, well, we have some persistent migraines that last more than 3 days. This is different because we know that this patient has a diagnosis of migraine. But usually the first time you diagnose patient is not less than 3 hours, not more than 3 days, up to 3 days. Most of the patients who have migraine, and we discuss, when we ask them about the headache, we ask them about how many headaches do you get a month. That's one. Plus, which ones are disabling? So the disabling fact is what brings more the patient towards the physician more than anything else, because migraine can be disabling. The treatment option ranges from medication that started years ago, all the way to the new medications that has been in the market for the last year or 6 months even. And start with tablets, goes up all the way to injection. Of course, treatment option has two sides. Abortive medication, which means that you have to take this for acute treatment of migraine, and preventive medication, which means that you're going to take it as a daily medication for treatment of the migraine. So you won't need the second one, which is the abortive. To decide when to come to the physician for a migraine is whenever you have the symptoms that are really clear, with the throbbing headache, one-sided or two-sided. Most of the time it's one-sided. Some people say it's behind the eye, and again associated with the same symptoms we talked about. If those symptoms are present, this is a migraine. If they are not present, we have to focus on other type of headaches that could happen, such as chronic daily headache, such as tension type headache, such as cluster headaches. Now, again, visiting the physician, it depends on the severity of the headache, and if you can handle it at home versus you cannot handle it. Other headaches can be treated with different type of medications most of the time. A cluster headache, depending on the type of cluster headache that you're using, most of the time there's a certain period of time where you have the clusters. It's a certain few months in the year, and then it's gone. Tension type headache depends on the environment around you, how you are able to handle things, and this can be called tension type headache. There is entity called overuse medication. That's when the patient start having headaches, and they kind of want to just use medication over the counter to take it so they can abort the headaches. And they start using one medication, over-the-counter medication, versus the other, then the third, then the fourth, then the fifth, and become used to those medication. And that's when we get something that is not a migraine. It's just because of how much they use the over-the-counter medication. We call it overused medication headaches. Very common, and it's treatable, and not similar to migraine most of the time. But migraine could be the startup to use those medications.